One of my favorite new partners is Warrior Salt. We talk on the show, we're trying to empower you to mind, body, and energy. Energy starts with being hydrated. Let me tell you, after a workout and with eating, if you're eating a healthy diet, it's hard to get enough sodium. Well, you wouldn't believe it. We were coached for so long that sodium's bad, but that's why I love this partner. No BS, just electrolytes. They keep it simple. We're talking about fruit powder and salt. There's no stevia, no citric acid, none of the bad stuff, just the stuff you need to stay hydrated. That's what I'm doing. I go to a workout, before workout, after workout. You need it both. If you're thirsty, you've waited too long. That's the point. With Warrior Salt, again, it's all about simple hydration that you need without anything that you don't want. One of the official partners here of Vibe Science as we take you to your highest vibe. On today's episode of Vibe Science, I talked to founder of bEHR Health, Kwame Terra, talking all about tracking health and fitness, but in a healthy way, not overwhelming you with data, but more giving you a lifestyle coach and ways to stay ahead of your health and fitness, along with some really interesting concepts for coworking and staying healthy while tracking it all. It's really about lifestyle management. That and more on Vibe Science.
We can improve environments, right? Make healthy foods more accessible in a certain neighborhood. But if you don't elevate the mind of the individual at the same time, the old mind is just going to recreate the old environment. But again, as I'm learning about what seems to actually be getting people to improve their health outcomes, I started thinking, well, how do I create a space that people can engage with on a regular basis that facilitates some of these community solutions that we're witnessing? I want people to swap out 1 or 2 or 3 things that they do per week at bEHR Connect that serves the same function as what they're doing in their daily life. So that could be coming to work at bEHR Connect. That could be doing brunch at bEHR Connect. It's serving the same function. You're getting the same fulfillment, feel like you're getting all of your needs, but it's in a more health-promoting way.
This is Vibe Science, a top 100 wellness podcast presented by the Radcast Network, breaking wellness barriers and making health truly personal. Here's your host, Ryan Alford.
Hello, and welcome to Vibe Science. We're always here to take you to your highest vibe. It's about mind, body, energy, and solutions that are happening, digital solutions in the health and wellness space. Got the founder of bEHR Health. It is Kwame Terra. Hey, Kwame, what's up, man?
Hey, Ryan. Doing well, man. How are you?
I'm great. Good to have you. Appreciate you coming, live in your camera to my camera. We're not. I learned, coming into this, I'll tell our audience, that I'm not from the South officially, according to Kwame, because I'm in South Carolina and he's in Louisiana. This was news to me. Everyone is always, with my accent that I meet up north is always, but I won't hold that against you, Kwame. I guess we could be Southern brothers together, right?
Yeah, no, for sure. It was funny. I was walking around Bourbon Street a few months ago, maybe during the Super Bowl, and I met a couple of people from North Carolina, not South Carolina, but we had this very conversation. And then we walked up and down Bourbon Street asking people if they considered the Carolinas the South, and most said no.
That's crazy. I got to start a petition on that, not that I really don't care, but it is funny, like geography wise, if you look at it. I'm like, well, if we're not in the South, I'll tell you what, that humidity sure does feel like the South.
I'll give you that.
Yeah. Cool, man. What you up to? bEHR Health. Talk to me.
Yeah, so we're actually 2 weeks away from the official launch of the bEHR Health app. And so our app gives you a health score, kind of like a credit score for your health. And then that score isn't static, right? It changes as you change. So if you go on a run or a walk one day, your score goes up a few points. If you get 2 or 3 hours of sleep one night, your score goes down. And then based on those changes, we make recommendations for how you can improve, as well as connect you with healthcare providers, resources, and really leaning into experiences and communities that help facilitate, the growth and development of your health and wellness. In many ways, our product is shifting from a focus on tech to a focus on helping people find their communities that, again, align with what they envision for their lives or where their lives already are, so that, just helps with accountability and health becomes more about your life as opposed to obsessing over tracking or an extra tool or task. It just kind of integrates into your life.
I like that a lot. I mean, as someone that's used a lot of these things like trackers and all that, I don't really do it anymore. I mean, I get blood drawn more than most people 3 times a year, but I love what you're saying, like integrating it in and not just like this constant, like in your face reminder, because I found it almost unhealthy. Yeah.
I
Like
think
the
so.
tracking,
Yeah, I think then we need to know the numbers, right? We need to measure and improve what you are measuring. But most of us, and this is an insight that I realized over the past 18 months, while most of us are literate, most of us aren't health literate. And so we can, I guess you can misunderstand or misinterpret some of the data points that we're gathering through all of these trackers that we're using. And then again, obsessed. And that can become problematic from a health standpoint, things like that. Or like, oh, if I didn't get a perfect sleep score on my oral last night, then I'm not going to have a great day. And the fluctuations day to day in your body, there's so much happening that it's hard to determine like what your health state is on any given day based on one data point. And so you really have to take a long term perspective on your day to day health data. And I just think that's a lot for people. And so we do center our app in tracking in a sense, but we kind of are starting to refer to it as like your passport to our experience. So in order to get into our co-working space that we're going to open up here next month, or get into our wellness events, or participate in our challenges, you have to have the app. But the focus will be on the experience, the meetup, the run club meetup, the yoga meetup, so on and so forth. So that way we're still tracking everything, because again, we can't improve what we're not measuring, but that's not the focus.
That's smart. And I think, I mean, you nailed it. Like, obviously, in this day and age, we have all this technology and different things, and the ability to sort of get markers to know, where our health stands and to get ahead of it. But the day to day stuff, I mean, it's not that it's not important, but it can be like too much, because if you're trying to adjust every day, like, okay, I'm 4% this way tonight. Okay, I got to sleep hard. I mean, it can both add stress, and I think some of these things, and it's being proved out, and you nailed it, like over time, like you can see the impact of certain changes over time, over weeks or months, versus if you're always trying to like beat the day before, that's a never ending mouse wheel to be on. And you can potentially not be allowing sort of your data to catch up, like, those markers to know what worked and what didn't.
Mm-hmm.
So I love this. I love the integration into the co-work and all that stuff. That's really interesting. I mean, I see in the notes here, like focus towards Black communities and things like that. So you want to talk about that at all, Kwame?
Sure. Yeah. So just to make sure it's clear, anyone can use our app. Again, you download the app in the App Store in 2 weeks officially. Our beta app is out now. You can access that, but might as well just wait for the official one to come out in a couple of weeks. And yeah, so we focus on the Black community because when I started, that's the problem that I was interested in solving. And when you look at the policies, practices, and beliefs that created the disparities that exist between Black people and the rest of the population, those were very targeted, policies, practices, and beliefs. And based on education, I feel like the solution should be equally targeted. It's just the most effective way to solve the problem. And so, yeah, we've focused on the Black community primarily here in New Orleans so far. It's a predominantly Black city, and we've learned a lot for sure, like about how to get Black people to engage with their health in a way that doesn't feel like a chore. And these are things, learnings that we gather from this are things that can be applied to any demographic for sure. One thing about working with, I guess, those who are struggling the most with certain challenges, when you're developing solutions for those, the impact and the insights can scale up to other demographics who don't necessarily have the same barriers. But if you develop solutions for, say, like, let's say it's some affluent white woman in LA, right? Don't have quite as many barriers as someone impoverished in the South, let's say. And so if we develop the solution around her demographic, then we may not have to navigate as many things to effectively carry out our solution for her. And then if we try to apply that same thing in a different environment, it won't work. But we may be able to take the learnings from the lower income community and scale up to them. So just a few just value propositions around the focus. But yeah, the disparities are stark. There's a 6-year life expectancy gap between Black people and the rest of the population in the U.S. When you extrapolate that across the entire population, 50 million Black people, that's like 268 million years of time lost. There's so much value there. Time is our most valuable asset. And so I created Bear Health to recapture that time so that we can create and bring value.
Yeah, I love it. Interesting. And that makes a lot of sense, and the fluid thing, you develop a solution there. It doesn't always translate down or up or whatever you want to call it, sideways. It's not about up or down. It's just different. And then if you start with base health issues for someone impoverished, a lot of those things carry across. That makes a lot of sense. Like, I don't know, like working that math in my head, that makes sense. I think it's also interesting, it does just seem like the education potentially, the sharing of knowledge in health and wellness, there's just a lot of opportunity in the Black community. It seems like that's what it seems like, because they don't get, if you're in an impoverished area, you're worried about you're worried about eating, period, not what you're eating necessarily. Let's just call a spade a spade. If I'm hungry, just give me some food. Don't talk to me about a salad. Like that. And I'm just being real. And I imagine, but now we are getting affluency and more, but we need education and knowledge shared universally. And that's what I feel like you're doing.
Yeah, absolutely. I think you make a really good point. So we can improve environments, right? Make healthy foods more accessible in a certain neighborhood. But if you don't elevate the mind of the individual at the same time, the old mind is just going to recreate the old environment, right? Or just purchase the foods that they're accustomed to that are still in the environment. And so you do have to do both at the same time. And that's ultimately part of what makes us more than just another health app and a true health equity platform, because all of our user health data goes into what we call the health score report, which is a real-time database of all of our user health insights. And we evaluate these month over month. We can see what the average health score in New Orleans is compared to the average health score in Atlanta or the average health score in New York. And let's say the average health score in New York is higher for the Black population. So let's go talk to people in New York. Let's see what they're doing. Let's see what their environments are like. And let's see if we can apply some of that to the communities in New Orleans. Because again, we have to raise both sides, the mind and the environment.
Yep. I love it. Talking to Kwame Terra. He is the founder of Bear Health. Kwame, I want to come back to the co-work integration thing. And I get that that's local. The benefits of this app are pretty clear, that they'd be universal no matter where you are. But I think it's really interesting in trying to create change, tying the app and technology to physical experiences and a community that is embracing and maybe empowering others in the community to live the lifestyle that you're tracking, right?
Right. That's, you just described our new solution. When I first started this, my first thought was, well, we don't know how bad we're doing. And so someone needs to communicate clearly to our community our current health status. And that's when I first had the idea of the health score, and we deployed that, and people have engaged with it, which is phenomenal, because you never know. You have an idea, you think it's great, you just don't know until you.
I know. You're like, don't call my baby ugly, but you can if you want to. Yeah.
Right. But I've been staying as close to the problem as I possibly can throughout this journey. And as I'm sure you've witnessed, the rise of in real life community fitness and wellness experiences that have created sustained engagement. I created a run club myself here in New Orleans. been involved with the development of a few. And it's so incredible to see people do something that they hate just to be around other people. People hate running. Yeah, I don't. I grew up in a family of runners. I ran collegiately, and so it's part of my life. But I know that most people hate it. But they show up every Sunday morning at 7 a.m. to run out for an hour. Why? And so that was really interesting to me. And then to see like what happens from the meetup to the community that's built, the support systems that are built. Because again, health is about life and quality of life and having a village in a sense. And basically that has kind of left our society in a way. And it just seems like these communities are starting to facilitate and reintroduce that concept um, to our culture. And so Bear Connect is actually wasn't expected this year at all. When I was doing the 2 million steps in April, someone had reached out to me from a run club who was consulting on some new real estate projects here in New Orleans. And he asked me if I'd be interested in opening up a space in some capacity. And again, I didn't have a clear idea at the time. And part of our vision for Bear Health is to have a nationwide network of clinics where so long as you're on the app, we'll know your history and be able to provide you tailored care wherever, whatever clinic you kind of step into. But it was really a focus on clinics, like medical clinics. But again, as I'm learning about what seems to actually be getting people to improve their health outcomes, I started thinking, well, how do I create a space that people can engage with on a regular basis that facilitates some of these, community solutions that we're witnessing? And so I've actually always wanted to open up my own co-working space. And so now we're opening up a co-working / wellness space where during the day, people can come in and again, be in a health promoting environment, right? All the snacks and juices in there will be healthy. All of the people in there will be for people on the app. So people who on some level are thinking about improving their overall health and wellness. And then we'll also host our meetups there. Right? So our Run Club meetup will be there and post run mixer will be there. Our yoga, our meditation, whatever other events we eventually put on the calendar. And it just becomes a space. And again, so originally it was like this nationwide clinic system, but I think we'll do this nationwide network of Bear Connects. There'll still be a clinical component. For example, we'll have blood pressure, cholesterol, and glucose screenings on site available for users. But yeah, and I'm sure it'll continue to evolve as we learn more and more. But yeah, I'm really excited about Bear Connect, and I think the community is really excited about it as well.
It's interesting. Like I think about myself, like growing up, and the space that you provide for this to happen matters, and the IRL thing makes a ton of sense. We need more of. We need to get back to more of that. I think we're getting better, but like needs to continue to grow. Like I grew up in the South. It was the South, Kwame. It was the South. But I think about like, okay, family get together. We did a lot of family get togethers, and you know what?
Yep.
They were a nice exercise in eating too much, eating terrible foods for you, sitting around and doing no activity. I mean, I grew up with fried chicken and like all this stuff and look, it was delicious, and we had good family time, but like it didn't really foster. And we had a lot of unhealthy people in my family, and it was like it didn't foster, good health or behaviors. And I mean, not that I wanted salad. I'm not saying that we couldn't splurge, but it's back to even for me growing up, like it was embedded in like eating this way. Like you get together and you do these things. If you don't create these spaces where you can come together, embrace these new ways of having community together in a healthy way versus established norms, even for my family growing up. I love that because I think, I don't know, we take for granted that everyone gets access to the same things, the same influences, and that's just not the case. And it wasn't for me. I mean, I'm a long way from that, but I just still just thinking about, like a young person growing up, and they've got a legacy of just sort of unhealthy habits and unhealthy eating. But yet we live in this modern world where there's technology like yours and, spaces like what you're creating, and it just makes a ton of sense.
Yeah, no, I appreciate that. And yeah, you make a good point. these traditions are good traditions, right? The family gathering, family reunions. I noticed even in my family, we haven't done family reunions in a while. And those used to be like a big part of just what we do. Like, I don't know everybody in my family. It's kind of my grandmother had 16 children. My grandparents had 7. Again, I don't know all my uncles, cousins. It's a lot going on. But we'd have these right. We'd have these massive family reunions. Yeah, at least a few hundred people there, and they were great. And we haven't had them in a while. But again, I think there's an opportunity to reintroduce it because again, there were things about those experiences that people really enjoyed. But how do we shift them a bit, or at least make sure that they're, for example, healthy options? At the family reunion. I've been eating a plant-based diet for the past 10 years, and still to this day at Thanksgiving and Christmas, my family still doesn't quite understand what I am and not allowed to eat. It's hilarious, but again, you have to build systems for people because you're not. It's hard to get people to change their minds and new things, especially after they've been doing something their whole life, and that's really what this infrastructure of Bear Connect is about. So what I really want to happen is I want people to swap out 1 or 2 or 3 things that they do per week um, at Bear Connect that serves the same function as what they're doing in their daily life. So that could be coming to work at Bear Connect. That could be doing brunch at Bear Connect. That could be, instead of going to the club, come to wine club at Bear Connect, where it's like it's serving the same function. You're getting the same fulfillment. You feel like you're getting all of your needs, but it's in a more health promoting way. Again, because I don't want, if I look outside and I see a bunch of people, obsessing over tracking their steps and, comparing their VO2 max and all that stuff, like, I won't feel like I have created the right culture because that again, like you're saying, just almost seems a little toxic. But if I look outside and see people communing together in brunch, but like now there are healthier options because they came to a meetup here and now they're like, oh wow, this is possible. This is something that we could, then I'll be happy to look outside. Because I just want to look outside and see people having a good life because that translates to health, period. If you look at these blue zones, right, where people are living well into their 100s, on a regular basis, they're not grinding it out in the gym every day. They don't do any of that. They just live a good life and with their families and with their communities, and that's what human health is about. I think the American way has made its way into uh, the health industry, and now it's an objective and a task, and it really just need to shift the way we live.
Kwame, by the time this episode releases, I think your app will be out probably a couple weeks. Yep. So as we close out, what can people expect at launch and how do they find it?
Yep. So you can go to the App Store. It'll be Bear Health, bEHR Health. The memberships through Bear Health is $10 per month or $100 per year. And that's a membership to Bear Health. That's not a subscription to the app. The app is the tool that you'll use to unlock the experience. Our ultimate value proposition that we want to communicate is that on this app, you can find your community. You're in real life. And so what you'll be able to see on the app in the Discover section is just a list of communities that exist throughout different cities. So if you're in Atlanta or if you're in South Carolina or what have you, you can find communities for yourself. Again, that are centered generally around health. And obviously, you'll be able to download the app. Your initial health score is going to be a number between 0 and 1,000. Anything above 680 is considered excellent, and that's our ultimate goal, is to get people to 680, because we don't want to just get people to where they are unhealthy, right? Or surviving. Right? In a sense, that's what I believe that our current healthcare system does. It keeps people alive. I don't think that it's designed to create maximum health, but that's our objective. It's okay that it's not their objective. And so anything, like, most people fall around the fair range right now, and that's to be expected based on the population we focus on. But each month since we've been tracking the collective health score, it's increased by about a point. So we went from 530 at the beginning to now we're at about 546. Again, still in the fair range, but overall improving. We do challenges all the time. I think that's something that people can look forward to as well. We did a challenge at the beginning of this year where we gave away 2 tickets to Super Bowl 59. If you completed 59,000 steps in a week, you were entered in for a chance. We gave away $5,000 during Mardi Gras 2024, where whoever steps won $5,000. That was intense. The first place did 100,000 steps on the first day. It was nuts. And then I'm really big into walking. Obviously, it's become a big part of our culture here at Bear Health. And it started when a gentleman did 1 million steps in 30 days. He actually lost 20 pounds. He got taken off his blood pressure medication. And when I think about what I set out to do with Bear Health, which is to predict, prevent, and reverse chronic conditions that plague our community, to see that happen with him and see it happen with others in our community who have followed suit, it's really inspired me to create a challenge, one that's really simple, right? Complete 1 million steps in 30 days, about 15 miles of walking per day, about 5 hours of walking per day. So it's going to take some effort, but it can transform your health. And it can transform your mind, because everyone that has completed that just feels like they can do anything, right? They reignite that spirit within themselves. And so yeah, you can look out for the Bear Million Challenge. Think about it like a 25 or a 75 hard, or it's one of those challenges that people just do. And so hopefully it can become a viral challenge. But you get to witness the evolution and improvement of health in the community in real time. And I think that's something to be a part of.
Hey, man, I love what you're doing. I appreciate you coming on and talking about it. Hey, that's what this show's about. Mind, body, energy. We got to improve it. We got to it's not about living. It's about living well.
That's right.
Appreciate you, Kwame.
Yeah, thanks, Ryan.
Hey, guys, you know where to find us, vibescience.com. We'll find links to all of Kwame's stuff, including all the Bear Health app information. Hey, get 1 million steps in. You can do that. You can do anything. I'm not going, I'm sweating just thinking about it. But, you got to use it or you lose it. It's all about mind, body, energy as we empower you to your highest vibes. We'll see you next time on Vibe Science.
The content discussed on this show is provided for reference and educational purposes. The content is not an attempt to practice medicine or provide specific medical advice. Always consult your personal physician for medical advice and proper diagnosis.
Thanks for listening. This is Vibe Science. To learn more or watch full episodes, visit vibesciencepodcast.com. Here's to discovering your highest vibe.